Welcome. The classic question of the nebulizer versus the inhaler. Most of the time, the inhaler will work as well as the nebulizer in patients with good respiratory effort and good coordination and technique. Now, if you have any doubts about the patient's coordination and technique, a spacer may work well to bridge the gap. Now, a spacer should be cared for by rinsing it with a little bit of water and with avoidance of scrubbing it dry on the inside, as this will generate static and make it less effective. Now, there are occasions as well where the inhaler will not work as well as the nebulizer, and in this case, this usually occurs in patients with poor respiratory effort due to lung function problems, poor mental status, patients who can't seem to follow commands, patients with severe joint or neuromuscular problems, and sometimes cost as well as a factor. Cost due to the fact that nebulized refills tend to be cheaper than inhalers. The next thing to consider is patient preference. Now, a patient may prefer the nebulizer due to the humidified air generated by the nebulizer, which may help mobilize secretions in some patients. The other thing is that most patients may feel a sense of jitteriness following the dose of nebulizer. That's because the nebulizer normally has a higher dose of the medication due to the inherent ineffectiveness or the loss of the medication in the environment. Now, the jitteriness may make them psychologically feel like they're getting a proper dose, as opposed to an inhaler where the side effects or the adverse effects may not be as apparent. So it's important to consider those as in your decision between choosing a nebulizer and an inhaler. The other option is a newer generation inhaler, also known currently as a Respimat nebulizer, that's by Boehringer Ingelheim, which is an inhaler with a mini nebulizer form. Now, I normally tell most of my patients, or I tend to be biased towards using the inhaler due to the fact that the inhaler liberates my patients, especially my COPD patients, in which mobility is an essential component of this state of health. Now, I encourage them to use a nebulizer only in certain situations which I had listed previously, but most of the time I try to push for them to get an inhaler and add a spacer to that. Thank you.